there, this is Dr. Paul, and thanks for tuning into this video from Waterfront Dentistry by Paul. Today we have Kirsten in my chair. Hi, Kirsten.
Hello.
So Kirsten actually came to us a while ago. We did a complete check on her. Everything was perfect because she is a flosser, right? Unfortunately, well, I shouldn't say unfortunately, but she was on a flight to Cuba and they served some yummy croissants on the flight, which Kirsten took a big chomp out of, and lo and behold, there was a little piece of stone.
I have no idea.
No idea.
Because I swallowed it.
Right, she swallowed it. But what happened was she kind of felt stars around her head. She heard a thump, but she didn't really think much of it till she landed.
Oh no, I fully thought
You
much
fully-
of it.
So don't fly Air Cuba.
Yeah.
Right, don't
well,
fly, yeah, okay. So anyway, so she felt something was wrong, and then after touching or landing in Cuba, she went to the local dentist, who kind of had a check and said, well, there's really nothing much wrong because
Yeah.
he couldn't really see anything. So cracked tooth syndromes are one of the most notorious things for dentists to diagnose, even with x-rays. So he said that, you know, there's nothing to worry about, and everything was okay for a while, but later on, Kirsten had a little bit of pain, correct?
Oh, I had pain right away.
You had pain right away?
I paid fully for 2 weeks and self-medicated in Cuba.
Okay, so she self-medicated in Cuba, of all places, all right? And then once she came back to Toronto, we had an emergency visit or checkup, and then we found a couple of things. But the biggest surprise was the entire tooth was cracked in half, and it wasn't really kind of split in two, it wasn't dangling, but it was broken till we had a look and we started treatment thinking let's do a crown to save it. But then the entire tooth was broken into half, and there was also a slight bit of an infection or an abscess around it, right? So again, I'll let Kirsten talk now and kind of give her experience, because what we ended up doing is we pulled the tooth out and we put an implant in there, which later on we restored, which is actually today. So Kirsten, what's your experience with us so far? You know, from what happened to how it was handled to the communication levels and such.
Yeah, I really appreciated the way that you went with the most most gentle approach,
Right.
which was like, we're going to try to save this tooth.
Right.
And that would have been the least invasive, but you know, the way that the tooth broke and there was no way to save it. So it was nice because I didn't have to leave here and have it dealt with later on. Once you got in and saw the problem, I really appreciated the fact that I just got to stay and you found a place for me, and we got it taken care of right away, which was really nice. I also really appreciated the communication around the timelines that it was going to take, and when you told me this would be a year-long process, I was shocked, but also really appreciated the explanation about why you take your time with an implant. And I've talked to other people who have had the implant done, like the post put in and the implant done right away, and they've had problems with their implants, so I don't anticipate that happening here. So it's been a nice process. I've spent a lot of time in the chair in the past year.
You had a parking spot for it.
Yeah, pretty much. Like I have my own chair, and now I know how to run the TV.
Right,
But,
yes,
but no, it's been a nice experience, if that's even a possibility with this kind of devastating experience. But yeah, none of the processes were painful along the way. Like, didn't believe you when you said you're not going to feel any pain with having your post put in. I didn't believe you.
Right, but I'm glad.
I had no pain, and throughout the process, aside from having the initial removal, I have felt nothing.
Right.
So it's been really positive. So
That's awesome. Thank you so much for saying. So what Kirsten's talking about is biology. We can't really accelerate biology. It takes a certain amount of time for an implant to be taken by the body and by the bone. So that's basically what she meant by saying we had to give it a whole year. But at the end of the day, she has a brand new tooth in there. Nothing is moved. Everything is more stable for the long haul. And she can chomp on her next croissant a little more bravely, I guess, right? So anyways, thank you for watching.
I'm off croissants forever.
So anyways, thank you for watching this video, and stay tuned. Thank you.